Okay, previously to taking CBD, I was considering would the effect of this drug um, counteract some of the valid correlations that I've made to my condition, my condition's emotional expression in regards to certain environmental aspects that are just in general on a societal level. And on that note, I became a little critical whether or not I would still have some of the same intensity towards some of those negative aspects. So I did take the CBD, and I did reach uh, um, restating levels of relaxation. I would test it a little bit, think about something a little stressful, and seeing what that negative thought, if that negative thought would change the overall value of my relaxing state, and it did. But then the general relaxation would come quickly again, mainly from like reassurance thoughts. So that's good. That's another in the light thinking, that usually when I'm feeling reassured, I have great feelings of relaxation regardless. So so it had relaxation effects it's still there right now, and it's good to reaffirm that. So that's a very, very positive attribute of this, and it feels greatly different than the relaxation effect that I would commonly get on a drug like Xanax for anxiety. Xanax was terrible. I mean, after it only worked so long for me, maybe the months where I would have my nadir, my lowest points, I would take Xanax on a regular basis, and the doctor prescribed 3 a day, but then up to 3 a day. I would take them all at once, although he advised against it. But then the people at the pharmacy were saying that for extreme panic attacks, you could take 10 milligrams at once. And respectively, my levels of anxiety were probably superior to what was commonly associated with a panic attack, given the tone of my perceived expressions, my perceived experiences. They are very, very, very intense experiences, and just outside of normal anxiety-causing experiences. Although I could see still reaching pretty intense level of anxiety, even on the general level. So, anyhow, 10 milligrams max dosage. I took that once or twice. It knocks me out. It's no difference than me effectively drinking 15 bottles of wine, or like 15 cans of beer, and then just passing out crazy stupid. So, I did regulate it down. I took more subtle amounts, but the 3 milligrams max a day wasn't sufficient for my intensity of stress. And it's also kind of under the surface implied that you should gravitate towards alternative means of dealing with anxiety, but they just don't readily express that within their office, or at least my doctor didn't. I found that out on my own through personal exploration. So, respectively, CBD does have many other positive qualities that would be very beneficial to somebody in my position, somebody with my diagnosis, which, by the way, is schizoaffective, which it means that it is a combination of schizophrenia and bipolar. CBD has been studied to be effective, has been found, and the studies show that it is effective in reducing the negative symptoms associated with people with my illness, people with my type of illness. Peoples. My name is Peoples. Leave me alone. Okay, well anyways, too much TV or not enough? Totally too much TV. That's a completely another topic that could stem out of that little expression right there. All critical stuff though. Probably too intense for right now. Most definitely too intense. So bottom line, CBD respectively is working fantastic. There is no psychoactive effects of it whatsoever. It actually has anti-psychoactive effects on some of the THC that it is bound with, just being derived from the cannabis plant, the sativa gene. So, bottom line is, I was going to also document that on the note of me being critical, whether or not I would just completely be oblivious to some of these environmental factors and possibly not even want to attend them in the future, which would be deconstructive to my constructive mindset. And I didn't want to get lazy just out of pure experience. So just by being at peace, so on that note, I wanted to see if I could stimulate a stress response, giving a better conscious awareness, or bringing more into my conscious awareness the different variables that are associated with the negative qualities of societal factors, environmental influences that I have now associated with, to be strongly connected to the traumatic experiences that I experience on a daily basis with my disorder. But disorder implies that there's no positive thing to be gained from the whatever it is, the hindrance, the impacting hindrance. And in all actuality, if when I started taking a constructive mindset to correlate things to my past, to see things critically, instead of just running directly to, oh, how does that feel immediately? And then that's not very nice. I don't want to be around that experience. Get away, push away, give me meds, anything possible. That is totally sticking your head in the hole kind of mentality. I'm vulnerable, I'm the victim. I was in that place for a very long time until I did a lot of research that came after a spiritual fast again, which by the way was reinforced by Dr. Alan Cott, 1970s clinical trials done on fasting for schizophrenia patients, and the success rate was 73% success rate, people that return to a state of relative normality, which means that they were able to deal with the symptoms and maintain the average lifestyle while doing so. Now, the average lifestyle, I mean, just as a given, is highly interwoven with a whole bunch of negative aspects of modern living, of this type of society, that quite frankly, a lot of people are migrating out of the impacting style of living. Just not so much of, oh, I'm taking a political stance or anything like that, but mostly out of health reasons, health, being healthier, being stress-free, being at peace in nature, working for yourself rather than, I guess, doing whatever thing comes your way to make a buck, basically to give your time away in return for something that you need is quite frankly defined as prostitution. So yeah, on that note, there's a lot of little subtleties in character traits that I noticed in myself and noticed in other people that are indicative of that type of exposure to being in that type of mentality, wise, unwise things to be exposed to. They were my young Padawan. Well, anyways, my third eye, where'd it go? Oh, I ruined it. There we go. Now I'm 100% contrived and integrated, respectively, of people that are, and myself. Okay. Well, so bottom line, I wanted the main thing to express here was that regardless of the CBD intake, which was one spray dosage under the tongue, which is very effective, that was counteracted for a little while in acknowledgement to some of the negative aspects that are common, that aren't so healthy, that are immediately relevant towards my life and the immediate health of my family. And that is something that is going to take much work to gradually shift into, rather than, okay, this, we need to do it now. It's going to take years of integrating information, mindset, shift in lifestyle to eventually reach that point. So on that note, I significantly benefit from being in temporary moments of relaxation. Just sitting with the current moment is very helpful, instead of me feeling like I need to leave the current moment and experience something that would naturally come after this, the CBD would basically pass through my system. So that concludes the video, and again, this was primarily for myself, but I will post it online just out of pure hope that maybe somebody else is searching for anything related to health and healing through their mental illness, mental crisis, without drugs, without common medications that can be very harmful in the long-term respect. Again, this is Morpheus. Actually, this is Alpha. Alpha male? No, I'm not alpha male. It was actually the closest solar system to our Earth, or the closest sun? Which one is it? The closest binary solar. I don't know. Whatever. That was a long time ago I chose that name. Alpha Procyon. Procyon Alpha, Procyon Beta. So really it's just Procyon. And I'm like, oh, Alpha.